Hi, welcome to the presentation, How to Enjoy Pain-Free Living Without Painful Surgery. The 4 steps to using Regenerate medical injection therapy to help you heal pain from arthritis, meniscal tears, ACL tears, tendon injuries, and muscle injuries. My name is Dr. Douglas Stoddard, and I first want to thank you for taking the time to watch this presentation. Over the next few minutes, I'm very excited to share with you a very powerful way that my patients are currently enjoying pain-free living and all of the benefits that come from this. In this presentation, I'll be showing you a simple 4-step process that can help you heal pain without painful surgery so that you can heal quicker, safer, and more healthily. Before I show you these 4 steps, let me ask you a simple question. Why is it that you took time out of your busy schedule to be on this call? Perhaps it's because you are suffering from musculoskeletal pain, and because of this, you are struggling to focus at work or have had to give up a cherished activity. A lot of my patients are also having difficulties with day-to-day living. Maybe this is you. You can no longer enjoy the lifestyle that you used to cherish. Perhaps you're frustrated that you can't play the sports that you love or travel like you used to. And then there's loss of independence. Perhaps you're feeling this, and because of this, you're worried about how you'll manage the future, who will look after you, and how they will manage. Or maybe you're struggling just to keep up with your children or grandchildren. All of these are concerns that I hear daily from my patients. So let's fast forward 6 months. What would it feel like to enjoy pain-free living? What would you be able to do? What would you want to experience and enjoy? Is it the simple act of walking? Maybe it's getting out of a chair without pain. Is it wanting to feel more confidence in your ability to put weight through your knee? Or how about resuming your favorite sport like tennis, but you haven't been able to play that for a while because of your ongoing shoulder pain? What about socializing with your friends with your sport and even competing at the high level you once did? And what if you had improved mobility and flexibility? Would that help in your day-to-day living? Would it help at work? Would it help your productivity? And imagine if finally you could reclaim your independence. What would that mean to your family, to your kids, to your grandkids? So how do you get from where you are, suffering from musculoskeletal pain, with dysfunction and facing difficulties with day-to-day living, experiencing loss of independence, to where you want to be, where you enjoy pain-free living, improved mobility and flexibility, and reclaiming your independence? You know, the answer is very simple. We can help with Regenerate medical injection therapy to take you from where you are to where you want to be. So what's that? Regenerative medical injection therapy has helped hundreds of thousands of patients suffering from joint, tendon, ligament, muscle, and spinal pain since the 1950s, using injection options that include prolotherapy, platelet-rich plasma, or PRP, and stem cell transplantation. By using your body's own healing potential, regenerative injection therapy is the easiest way to improve stubborn musculoskeletal pain without painful surgery. I've been a sport medicine doctor my whole career, since the mid-90s. As time went on, I realized that there was a big gap in the way we handled our patients' injuries. There was various forms of therapy, orthotics, bracing, and medication, all on one side. And on the complete opposite side was surgery, with all of its risks and major commitment. There was no middle option, and I really thought there needed to be one. Along the way, I heard that a surgeon in the 1930s named Earl Gedney injured his thumb after catching it in the doors of his operating room. After the injury, his thumb was loose and painful and unstable due to ligament tearing around one of the joints. Naturally, this could have been a career ender for a surgeon. Some physicians at the time were using different solutions to inject into injured ligaments to repair them, and Dr. Gedney, out of desperation, decided to try this approach, and voila! It did work. His thumb pain went away, his thumb stabilized, and his operating career was saved. In time, this therapy was called prolotherapy, which derives from proliferative injection therapy, where the solution injected stimulates proliferation of cells in the injured tissue to heal the injury. Now fast forward to the present. The solution being injected has changed over the years, and now we inject platelet-rich plasma, or PRP, and stem cells. But it's the same principle. We're just stimulating the body to heal itself. And what a wonderful thing that is. So there it was, the middle ground between more conservative care like therapy and more aggressive and invasive care, surgery. So now, several years later, after doing many courses, piecing together the knowledge needed to be confident in injection therapy techniques, and having trained many physicians along the way in these approaches, our team has treated a myriad of patients with PRP and stem cell injections. I still highly respect our surgeons, and I know that they are sometimes needed, but we now can offer our patients a middle ground alternative when more conservative measures are not helping to their satisfaction. And that's my story. So you're probably wondering if regenerative medical injection therapy is for you. Let me tell you now that this is the right treatment for you if you have arthritis. Any type of arthritis that causes you joint pain and dysfunction. The most common type is osteoarthritis, or wear and tear arthritis, which most commonly affects the knee, followed by the hips, but really can hit most joints of the body. This therapy can also help treat torn cartilage, and what a nuisance torn cartilage has been over the years for many, many patients. Torn cartilage is most commonly seen in the knee, where it is often called a torn meniscus. Back in the day, our surgeons removed damaged and torn cartilage, not knowing what it meant for the future of the knee. Well, this often produced immediate pain relief. The problem is that now we are seeing those patients having developed significant arthritis. We now know this beyond any doubt. Removing torn cartilage or a torn meniscus is the worst thing you can do for the future of your knee. Injection therapy can also be used to fix torn ligaments like the ACL or anterior cruciate ligament so that your own ACL heals again without the need for surgery. It also successfully treats torn tendons like the Achilles tendon, the patellar tendon, or the rotator cuff tendons in your shoulder. I want to take you now through the 4 steps in this whole process. Step 1 is the preparation phase. Most patients are at the stage where they are considering regenerative injection therapy, have been struggling with their problem for some time. As a result, they have developed some muscular weakness and loss of flexibility. It's helpful to try to regain some of that lost function with some simple exercises prior to undergoing the injection part of the program. Sometimes this is more difficult than others. But if you can arrive on the doorstep of the injection, having gained just a little more strength and flexibility in the affected area, this is helpful. A good therapist can be very helpful in this preparatory phase. It doesn't require a lot of time. Just minutes a day can make a big difference. Additionally, when dealing with arthritis in the leg, be it the hip, knee, or ankle, weight loss is also very helpful. Reducing the load through the joint can go a long way to maximizing the results of regenerative injection therapy. The other part of the preparation phase can include manufacture of a custom-made brace to help with recovery. I use these a lot with knee injections and feel they're a very useful adjunct to this treatment. The injection process then follows any preparatory phase. An actual stem cell injection takes about an hour from start to finish, and there are a few different sources where we may get stem cells, but the 2 most common are fat and bone marrow. Whatever source is used, once harvested, the sample is then cleaned and concentrated. At the same time, some blood is drawn from your arm, and this blood is made into platelet-rich plasma, or PRP, by spinning it in a centrifuge. You'll note on this slide some of the equipment used in this process. The syringes and containers on the left are used to make PRP, and the centrifuge is shown on the right. Once we have stem cells and PRP, we then mix them together. I call the stem cells the seeds and the PRP is the fertilizer. Under ultrasound guidance, we then guide a needle into the target area and we accurately inject. It's important to guide the needle with imaging to ensure you're actually injecting where you think you are, as sometimes we doctors think we are in the right spot when actually we aren't. What you see on this slide is an ultrasound-guided injection into someone's shoulder subacromial bursa. The large arrowhead on the right points to the needle, which is clearly seen on the ultrasound image. Once the injection is complete, you are given some medication to help manage post-injection discomfort. Very few people need this for longer than 1 to 2 days. Contrast this to surgery, which can require several weeks of this type of medication. The final step in the injection phase happens a few weeks later, where we do a booster shot, which is just more PRP to add extra fertilizer to the previous injection. Movement is encouraged after both shots, and rehab should begin very soon after your initial stem cell PRP injection. Step 3 in this process is the rehab phase. And wow, is this an important phase? It's important not to think that once the injection is over, that the process is complete. Rehab is very key in terms of encouraging optimal healing and return of strength and flexibility, especially since that the injured part probably hasn't been normal for quite some time and has been allowed to get weak and stiff. The rehab process is much shorter and easier than after having surgical interventions, often cutting in a third to a half the average rehab time compared to surgery. The final step is optimizing for the long term. The first component of this is bracing. For joints where a brace can be applied, like the knee, these are useful in the recovery period to support and stabilize, and also are useful on a long-term basis for activities that are extra challenging to the joint or the area injected, such as skiing is to the knee. The second component is orthotics, which are also very helpful for controlling abnormal foot mechanics and are useful for patients who have had the injection procedures done on any part of the leg, like the hip, knee, or ankle. The third component is maintaining an active lifestyle, which is so important not only for physical health in general, but also for the area injected. The final component is diet, the guidelines for which are constantly changing in terms of supporting joint cartilage, reducing inflammation, and optimizing overall health. Currently, we are recommending a low carbohydrate and low insulinogenic diet to meet these requirements. Additionally, we supply 3 supplements in the immediate 2-month period following the injection to facilitate repair of the injected tissue. Now that I've introduced you to the 4 stages of Regenerate medical injection therapy, let me share with you Joni's story. Joni was a very active lady who came to me regarding chronic pain in her upper right hamstring, near the sit bone. She had torn it water skiing several years prior and needless to say was not doing well. She was in constant pain, unable to sit, and had to give up her favorite passions, yoga and running. She was also a yoga instructor, and you can imagine how difficult this was for Joni. She had tried everything she could think of, lots of therapy, medications, rest, no luck. I re-scanned Joni's hamstring, and sure enough, she had a very large tear still there. Her best chance for healing was a stem cell transplant, and a short time later we did just that. And these are Joni's words several months after the procedure. Dr. Stoddard, I am running a mile at less than 8-minute pace now, just 2 miles for now. But my hamstring tear feels great, and I am doing a body combat class with tons of kicks and jumps and step and boot camps and all the yoga I want without any pain at all. Honestly, there were times I didn't believe the stem cell injection was going to work, and it feels like a miracle, but it did. After 3 years of pain, it changed my life. You changed my life. Thank you. And there are plenty of other testimonials and successful patient stories just like Joni's. Now that we have reached the end of the presentation, you're probably wondering what to do next. The answer is very simple. If you feel that Regenerate medical injection therapy will work for you to help you enjoy pain-free living, have improved mobility and flexibility, and be able to reclaim your independence, then contact us to book your free consultation. During this consultation, we will review your diagnosis, any relevant imaging, what you have tried so far, and all of your remaining options. We will also review the risks, side effects, and costs of Regenerate medical injection therapy if you are deemed to be a candidate. We also will review the preparation and post-injection periods and relevant guidelines for these times. We also offer phone consultations for individuals who are out of town and unable to make the commute. By the end of the consultation, you will be informed, more educated, and empowered to make the right decision for yourself. In order to book your consultation, you can either call us at 1-855-847-3975. That's 1-855-847-3975. 847-3975, which is North American toll-free, or you can email us at info@regenervate.com or visit our website at www.regenervate.com.